Well, what you have is you have federal standards, but you're giving flexibility to states with the understanding that a small rural state like Vermont is different than a state like New York State or California. So you're going to give people flexibility. But the program, importantly, is administered at the state. And why that is so important, I think, is that people have more access to their state legislature about what should be covered, what should not be covered. And they can get into that process much more effectively at the state level than they can at the national level.
So how does it work for people?
It works for people is that we're all in it together. That instead of having 10 different insurance cards in a given state, you have one. In the state of Vermont, it'll be the Green Mountain card. You can go to the doctor that you want, you go to the hospital that you want, and there will be one single payer paying the costs. When we do that, we're going to save substantial sums of money in doing away with a lot of bureaucracy and administration, a lot of waste in billing. We spend billions of dollars a year as a nation arguing about whether we're covered or we're not covered. When you are covered and your health care dollar goes into health care, you save a whole lot of money.
And how about costs? I mean, we may save, but in terms of the costs themselves, do they actually come down? And how?
They sure do. Well, you know, different studies may show different conclusions, but the bottom line is certainly in terms of per capita expenditure, costs go way, way down because you do away with a whole lot of bureaucracy inherent in a multi-private insurance company system. So the savings are enormous. They will be enormous in Vermont. We have seen in Taiwan, for example, which moved from an American-type system to a single-payer system, their administrative cost went way, way down. In that country, you walk into a doctor's office, you give him or her your card, your payment is instantaneous. You don't have to go through a whole lot of billing process. It saves significant sums of money.
Enjoy GRITtv? Want more people to see it? Well, we are making our program available free to public television stations coast to coast. If you would like to see our show on your local public television station, please give them a call and ask for GRITtv with Laura Flanders. Thanks.